for inviting me today, and I'm really really excited to be able to talk with you today about mental health. It's been if there's anything that's come out of the pandemic, any kind of silver lining, it's that discussion has been increasing significantly and getting a lot more attention. And especially people in the positions that you have right now, you're right on the front lines. You're feeling the effects of the pandemic directly. And so
I got the message.
Self-care is extremely important for all of us through this, but especially those who are working right on the front lines. And so I'll just give you a little background on myself, and then we'll start with the presentation. And feel free to put questions in the chat at any point during the presentation. If it's something relevant to that moment and I see it, I will address it at that moment, or otherwise I'll go through the questions in the chat at the end and try to make sure that all of your questions are answered. So as Beth said, my name is Dr. Athena Trentin. I am the Executive Director of NAMI North Texas. We're the local affiliate of the National Alliance on Mental Illness. My background is I have over almost 30 years of experience in not specifically mental health, but a lot of mental health related positions that worked on building community, working with underrepresented communities, international students and scholars, and helping them adapt to environments that definitely affect mental health, because they're environments that were new to them, that they hadn't experienced before. Maybe it's coming to the US and experiencing the culture, or marginalized communities, being a first generation college student and navigating those waters and learning what that identity is. So all through my career there has been a component of mental health in it. And this is the first time I really get to dive in deep. And it's really interesting. NAMI is very focused on lived experience and making sure, as we're represented, people do have some sort of lived experience, either as a family member affected by mental health, mental illness, or as a peer themselves. And being hired in this position was a very serendipitous process for me, because I was one of those people who kept going through life saying, oh, this anxiety, this depression, it's because I'm going to school and I'm working full time and I have these other health conditions, and always blaming, my anxiety or depression, or as my therapist calls it, little t PTSD symptoms on something else. I never recognized them as mental health, because I myself saw that as weak. I'm weak if I succumb to that. So I'm just going to keep pushing forward and push and push. And push to the point where, when I was working for the California Institute of Technology, I ended up having to take a 3-month leave of absence and really look inside myself and say, why can I not get up in the morning? Why am I so tired? Why, all these whys. And I found that it really stemmed from being a teenager. The depression and anxiety I experienced was just blown off. Oh, she's in puberty, she's a girl, she's in high school, and nobody took any of that seriously. I can remember being little and giving myself stomach aches when that anxiety came up, and I never knew how to recognize it in myself. And I remember a friend of mine in 8th grade died by suicide, and I would sit there crying at night saying, is it worth it? Show me a sign. And everything that, I don't know if I ever really mentioned that part to my parents, but everything was blown off as, she's a teenager, she's a girl, she's going through puberty. So that's what I thought it was all along. This is just something that I was supposed to endure because I'm female and I'm hormonal. And we've got to get that conversation going and understand the symptoms earlier in life. So and my experience is minimal compared to a lot of the stories that we hear from families and members of our community in relation to experiences with bipolar disorder, schizophrenia, borderline personality disorder, even, the overlapping of substance abuse and mental health, ADHD and mental health, things like that. So it's really, really important that, this is why I'm so happy to be able to talk with you today and get people talking about mental health as if it's just like you're talking about, I'm a diabetic or I broke my leg last week. And so that we don't have to hide that. So we'll talk a little bit about stigma today. We'll talk about what is mental health, how does it affect people in the United States, and what does it look like here in Texas? So I am going to share my screen right now so that I can, so if you don't have the slides, you don't have to worry about following along on paper or your computer. I'm just going to put the slides up on the screen here. And we'll get started. So, why should we care about this? Mental health is just as important as your physical health. It's actually part of your physical health. And we'll see later on how it does affect your brain physically. And just as I mentioned, through my life, I'll give myself stomach aches. Right now, my anxiety, manifests itself by me chewing on the insides of my mouth, and my tongue will get so raw sometimes. I've had to start chewing gum because I don't notice it anymore until it's too late. So how do we recognize this in ourselves? How do we recognize this in our loved ones? And how do we make sure we have a very healthy, balanced life? And based on what I have learned about all of you, everybody somehow is in that, frontline worker, healthcare, social worker area. So a lot of times people just think, oh, you know how to take care of me, so you must know how to take care of yourself. But do we actually do it? We are in, just like those of us in nonprofits, we're in this for everyone else, not necessarily for ourselves. So, a lot of times we're putting everyone else first and ourselves last. How do we make sure we take that time? Because if we're not healthy, and we say this to the family members who call us all the time, if we're not healthy, how are we going to be healthy enough to be there for the person who really needs us? And that could be your clients, that could be your patients, that could be your own family members. So how can we make sure we're healthy enough in every aspect of the word so that we can be there for the people that we are devoting our lives to? So, just a little bit on who is NAMI. NAMI is the nation's largest grassroots mental health organization. We really focus on building a community, what I call it is a non-judgmental, supportive, stigma-free community for people affected by mental illness. And as far as I've learned, we are one of the only organizations that really, really recognizes the impact it has on family members. It's not just the person with the mental illness. The family members are affected just as much, just in different ways. And with Texas being 50 out of 51 in access to mental health services, the most phone calls we receive from people are from family members with adult loved ones trying to get them access to mental health care, when a lot of times they're refusing to go. And it's next to impossible in Texas to get somebody, especially if they don't have health insurance, to seek out that assistance. So a lot of what we do is fielding that above and beyond the programs we offer. So NAMI began in 1979. It was just a few mothers sitting together and talking about the lack of resources for mental health and communities not knowing and understanding what mental illness really is and what it entails and how it affects families. So we have over 600 local affiliates, which NAMI North Texas is one of those, in 48 state organizations. And the local affiliates are responsible for that on the ground grassroots, let's pull this community together and, talk about it, get things out in the open, get a comfortable space for people to be, so they know they're not alone, so they know they have people to go to. they can get support and be supportive and find people who have similar experiences, because I don't know how many phone calls we take, a family member calls, and a lot of times because of Texas law, we can't do a lot to help them get their family member. And I'm sure all of you have experienced some of this before, being in medical fields, getting a family member to the care that they need if they're over 18 years of age. But they feel like they've gotten resources because all of a sudden they got to just unload and talk to us and somebody who understands. And that makes all the difference in the world, changes their attitude, gives them more motivation to really be that advocate. So let's talk about mental health itself. And I'm, you're all professionals in an area where we do, where I'm sure you've got a really good concept, a deeper concept than a lot of the other audiences that we talk with. But a big piece of it, because I thought I was, well informed and all of that in relation to mental health when I was helping the students and the community members that I was helping. But then I myself felt like it was a weakness of mine. And being with NAMI, I've found out it's actually a strength to recognize it in myself. It's a strength to recognize it in your loved one and be able to speak up and say, I think it's time we talk and see if we can't find some help for you before this gets to a point that it's going to be harder to find help, harder to find a successful recovery process. So the other piece is it's a whole spectrum of medical conditions, and we'll see on the next slide how it affects our brains from one end of that spectrum to the other. But as I mentioned earlier today, I have been impacted by mental illness. I ignored it. I caved into the stigma. I no longer do that, but I fully acknowledge that I am in a place in recovery where I am a fully functioning, can work a full-time job and have found the self-care that I need. And I'm not on the other end of the spectrum where I'm hearing voices, I'm paranoid, and I could be harmful to myself or others. There's a whole bunch in between that. So we want to make sure that we recognize and not blow off that one person who says, well, I have anxiety, and not think that that is also a mental illness. That's just, with the pandemic happening, everybody's having anxiety. There's, you'll see when I go over statistics, 1 in 5 people in the US pre-pandemic are affected by a mental illness. And that's experiencing mental illness, not just a family member, but actually experiencing it. So you have a room of, 100 people, 20 of those people are affected by mental illness. They do not have official statistics out yet, but the estimate right now is that 3 in 5. So that 20 people out of 100 has just changed to 60 people out of 100 are affected by something on that spectrum. And we just actually had a meeting with several clinicians in child and adolescent psychiatry yesterday, and just the increase in female suicides has been significant. And the increase in issues with children, their symptoms have been exacerbated, not just in children, but in everybody. And someone who may not have had a mental health condition pre-pandemic are now experiencing, some are experiencing not just anxiety, depression from being isolated and the uncertainty, but they may have been predisposed and have not had significant enough symptoms to recognize it in themselves or others in them. And now all of a sudden they are hearing those voices. This pandemic has created the environment that triggers that. So there is a genetic component, but we'll also talk later how it does not, mental health and mental illness does not discriminate. And so we'll talk about that in a minute as well. This is an important slide because if you're a visual learner like me, this really pulls it all together. This is showing your brain activity. And My doctorate is in education, so I am not going to pretend. You all have a lot more experience in the medical profession than I do. So the best I can do with this is say, look at the difference in the brain scans. And the normal brain scan, you can see a nice balance of all the different colors and the activity in the brain. And then just look at the depression brain scan, and you've got a very significant dominance of blue. And then bipolar, you're getting a little bit more of the yellow. You move into schizophrenia, you're getting more yellow and orange and red. And then all of a sudden, the OCD brain scan, you're just overwhelmed with the red, the orange, and now you're getting some white. And I can't tell you what exactly each one means, but this visual, really helped me understand that this is a physical condition. Any kind of mental illness is a physical illness, just like diabetes. It's chronic, just like another one I like to mention is sickle cell anemia, and I'll say more about that and why I bring that one up when we talk about how mental illness does not discriminate. But the important piece of raising awareness and making sure that we are, getting those conversations going is to help people understand that if we could just help people be more comfortable talking about this, treating it as a physical illness. You break your leg, you go, you get it reset, get a cast put on it, and you're given pain meds. Yeah, you definitely, with a broken leg, you want pain meds so that, it alleviates what is taking you away from being able to live daily life. Same thing with mental illness. There's nothing wrong with taking medicine because you're taking medicine for a physical condition. The physical condition is the chemistry in your brain. So that's where NAMI comes into play, is where we help in venues like this get that conversation going. And here's just some facts. We've got a couple slides of statistics. I'm not going to go one by one. I'll leave this on long enough for you to be able to see it. You also have the slides yourself. You can look back at it. I mentioned the 1 in 5. So the one on here that I would like to highlight is the average time between symptom onset and treatment is 8 to 10 years, because symptoms can be so subtle that, just like I mentioned with me, especially, you'll see, I think on the next slide, that when most of the symptoms start showing themselves are very young in life. If we can do interventions younger, we may be able to prevent the episodes, the significant crashes, like the 3 months I had to take off of work to be able to realize I needed some self-care and there is a mental health issue going on, and to actually address it. I may have been able to avoid all of that if people took my stomach aches and my anxiety seriously when I was a teenager. Then it won't take 8 to 10 years to actually get treatment. And then just a few other things to introduce to you in relation to some statistics. I think the 60% of adults with a mental condition do not receive treatment. There's a lot of different reasons for that. Number one is stigma. There's stigma in cultural communities, in general society, in professional communities, in faith-based communities, you name it, there's stigma everywhere. And so the more we can get this conversation going, the more we can penetrate all of those different communities and dispel the misperceptions about what mental health is and is not. And then suicide being the leading cause of death for people ages, or second leading cause, 10 to 34. We may see that change as well because of the pandemic, and especially after the conversation that we had yesterday with the child and adolescent clinicians. So you may see those changing once we get statistics back from this past year. So let's talk about you, mental health in the workplace, and how does it affect us as an employer. Some of you may be managers, you may be in HR, you may be in charge of making sure that people have the benefits that they need. And how do you, or you have to advocate for your team and say, we need to make sure we have insurance that covers mental health, that covers this and this and this. Here's some statistics that you can bring to that negotiation. Mental illnesses cost the US US companies $200 billion in lost earnings each year. That's taking time off work, negative impact on productivity, increasing medical visits, which thus increases the costs of your benefits plan. So it's really important that we also help our employers understand, and this is the time to do it. This is when employers are really listening, because we're getting more requests than ever to speak with larger companies about this and helping them develop a plan to say, how do we make sure that we are addressing the impact of this pandemic? And then how do we continue doing that and recognizing that mental health is a big piece of, how productive you are in the office, how often you have to take sick leave, how honest you can be about taking that sick leave. We had an employee here over the summer who decided to, be back with her family, but while she was working here, her daughter has borderline personality disorder, and she literally came to me crying one day saying, oh my God, it just feels so good to be honest with you and not make up an excuse why I can't come to work this morning, because she was able to come to me and say, my daughter is having an episode this morning. I need the morning off. I may not be able to come in this afternoon. It depends. She's over 18 now. Depends on if I can get her help. And we're like, okay, no problem. Take your sick time, and we'll figure it out. If you run out of sick time, we'll find a way to make sure that you can take care of your daughter, but also have the ability to make sure you keep up your responsibilities in the job. So it's really important that that we create an environment where people can be honest, and it makes such a huge difference for retention, I would say post-pandemic, because the pandemic is influencing people on what their comfort level is in relation to coming back to work or being at work or, being with their families. What can you do? And there's, if anybody around you is affected or you are, don't be afraid to find that person. If it's you who's having an issue, is there somebody you trust? Is there a family member, a coworker? Is your supervisor somebody you can go to and say, I'm having a rough day today? And something triggered me today in what I'm doing. And every one of you, just the field that you're working right now, I can only imagine how many triggers you have each day. And like for us, when we're answering the phones, that same person I told you about whose daughter has borderline personality disorder, every once in a while, she'll take a phone call, it will trigger her, and then she'll come to us and say, I can't take any more phone calls today because that triggered me. Okay, no problem. I'll take your phone calls, turn your phone off, and just, self-care, take care of yourself. Don't be afraid to ask other people how they're doing. And not just the American, hey, how you doing, and keep walking as a rhetorical question. It's the no, really, how are you doing? For those of you who are working remotely, make sure if you're supervising a team or you're part of a team, when you're on a Zoom meeting, and make sure people have their cameras on. The body language is incredibly important. I can tell you at the very beginning of the pandemic, one of our employees, she's normally our, comedic relief, our jokester, and she was really quiet one day. And if I didn't have, but when I asked her questions or when it was her turn to speak, she, you couldn't tell anything was, wrong that much. She just didn't tell a lot of jokes. It was morning. She could have been tired, not had her coffee. I could have blown it off, but I saw her body language on the camera, and she was taking the hoodie she was wearing and pulling it up over her head and just sitting like that and covering her face. And that is not what she normally did. So I called her up afterwards, asked her what was going on, and she had found out her cousin died from COVID. And so having the cameras on was extremely important while working remote so that I can see at least the shoulders up body language, because you could miss something, and we're missing things being virtual like this. We're missing a lot. And so having those check-ins, check in with your family, making sure you have open lines of communication. Even, you know, technology has really overcome our lives, but it's a good thing as well. You know, avoid judging when you're listening. That experience is that person's experience, and it's very real for them. When they're hearing voices and the voices, you know, don't exist, they exist for that person. It's very real. And, you know, I'm probably talking to the choir. You've probably, you know, been through trainings and experienced all of this. So I'm not going to go deep into those pieces, but, you know, just the big thing is assessing the level of danger to oneself or others, making sure that if it gets to a point where you think there's something to really, really be worried about, knowing what to do, where to go, how to access services. A mental health first aid class is something that's, you know, that's very, very specific in helping you learn what to do, when to do, what language to use. So if you don't have training in that yet, I highly encourage finding a mental health first aid class. We offer them once in a while, but you can go to their national website and look up the classes that are being offered in your area, and they are being offered virtually. So I was mentioning before that mental health does not discriminate in any way, shape, or form. There's nothing that says biologically mental illness affects one group more than another, be it gender, be it race, be it, you know, any other identity. It's and that's where sickle cell anemia comes back in. There is scientific evidence that shows sickle cell anemia affects the African American Black population much, much more than any other community. But so there are illnesses that do that, but mental illness doesn't. But the key piece is that even though biologically it doesn't affect more people, mental health conditions, or genetically, it really affects marginalized communities a lot more. And not just BIPOC communities, it's socioeconomic status, it's access to resources and knowledge and healthcare. And then the stigma in those populations. I mentioned before, the stigma could be in a cultural community, racial community, faith community, your professional community, depending on where you work. You're a law enforcement officer. If there's so much stigma in law enforcement, so it could be professional. Lack of cultural competency among health providers is a very big deal too. I can tell you, again, not just BIPOC communities, so that's Black, Indigenous, people of color, law enforcement, firefighters, cultural competency in a therapist. I literally was told by one law enforcement officer that he tried to seek help from a professional, and that person could not handle the repetitive trauma that he was trying to relay to her and talk to her about. And she got up and said, "I'm sorry, I'm not the right person for you. And she walked out. And so getting that cultural competency, the language barriers, and, as we mentioned, socioeconomic status and insurance. So just recognizing that there are specific communities who have a harder time recognizing, accessing services. And so you will see in statistics that those communities generally have a higher rate because they're not getting the resources that they need. So getting to NAMI and what we do, introducing what we do, we work based on 4 pillars: advocacy, awareness, education, and support. So we have advocacy at the local, individual, local, national, and state. So individual level, that's the NAMI affiliates, and the local level, and it's not just legislatively, it's building that community. So we learn how to advocate for ourselves, teaching family members to advocate for their loved one, teaching people to advocate for themselves with their psychiatrist, and saying, no, that psychiatrist, don't just go to anyone. You interview that psychiatrist first. You decide, you get to decide if that psychiatrist is right for you. The psychiatrist doesn't make the decisions on who you're most comfortable with. Awareness, we've talked a lot about what we do in raising awareness. I'll go over some of our educational opportunities, but a big piece of our awareness is making sure we have education classes, support groups. We do presentations like this and just get that conversation. The more we can talk about it, the more normalized it becomes, the more people who will seek out the assistance that they need and recognize when they need assistance in themselves and their loved ones. And then I talked before about, the support in creating that community of support, that no stigma, no judgment, supportive community that we really need to overcome the stigma that is still within all of our communities. So the advocacy arm, NAMI Smarts, that is a class that helps teach you how to advocate at the legislative level. And once a year, although we did it virtually last year and the year before, hopefully this year we can take that bus down. No, it happens every 2 years in Texas. Sorry, I'm originally from Michigan. But every 2 years in Texas, we work very closely with our state organization to advocate for positive, influential, good mental wellness legislation and advocate against anything that could hurt access to mental health care. So that's NAMI Smarts, where we work on advocacy. And then mental health first aid is not just advocacy, but it's also, I'm sure a lot of you have heard about it. A lot of it has to do with just really being able to understand what's happening and take that deep dive into what can I do to make sure I have the awareness and I know what to do with someone who's possibly struggling. The awareness arm, big piece of it is decreasing that stigma. So our job in NAMI North Texas is to decrease stigma in North Texas. And that's getting the conversation going. And the way we do that is early interventions with our Ending the Silence program. Your children, you may already have had this presentation in your school, but this is our early intervention, getting the conversation going at a young age for middle school and high schools. And we also have a parent's presentation and a teacher presentation to make sure that they have the tools to be able to recognize it in their students or in their children, to know early intervention, when early intervention is necessary and where to find that assistance so that they don't have to go to college, drop out of college because they have a crisis. In Our Own Voice teaches us how to tell our stories and gives platforms to be able to share that. And we train you so that we help you understand where you are in your recovery process, to know when that is a therapeutic thing for you. And everybody who does that for us or does the mental health 101, which is this presentation right here, and then we customize it for the audience, that becomes, we have so many people who come back to us and say, this is what I need. I needed to be able to know that I could go out, talk about it. And, then people coming up to me saying, oh my gosh, you're the first person that I feel like I can tell you. And then they just unload. And it's just, you get to a point in your recovery, and our family members, same thing, where it becomes a therapeutic versus a stigma to discuss. And we have education classes. We are peer-to-peer. These are all of these. Let's see, basics is 6, home front is 6, but peer-to-peer and family to family is 8 weeks, 2 hours a week. And you must identify with as a person, as a peer, or as a family member. NAMI Basics is for parents of minor children. Home front is for veterans. And Basics and Home front also now has on-demand online at NAMI National, if we don't have one available for you to attend at the moment. But these are all classes to help you understand the what's happening to you, what's happening to your family member, what medications are out there, how to advocate for yourself, how to develop a community of support, how to use NAMI as your community of support. And these classes are really where we get those community members who say, I want to dedicate more time to this. It's not just going to be a go to class and move on. It's, I want to be part of this community and I want to help raise that awareness. And then the support, our two main areas of support are our support groups. Right now, our support groups are virtual. Connection Recovery is our peer support group, Thursdays, 6 to 7:30, and you would be able to register on our website. And then there's the family support group, and these are very, which is Tuesdays, 6 to 7:30. These are really, really key. If you have clients, family members, anyone, if they're, it's really easy to get on if you have the technology and you're comfortable with Zoom right now, just get on and you can sit back and listen and just know there's a community out there who knows what you're going through. So this isn't just for you, this is referrals, especially in the areas that you work in. You can hand out NAMI's information. If you don't know where to send them or you don't know where to go, NAMI is a great first place to send people, because we can talk through it and we can say, all right, here we've got those connections in the community to really find out where that first stop for that person should be. Maybe it's not a clinic appointment, maybe it's a support group, or maybe we refer them to APA, because the association, some addicted persons. I'm sorry, I keep mixing up the words in that, but that is for people who are double diagnosed with mental illness and are in recovery from some type of substance abuse, substance dependency. So maybe it would be better for them to go to an APA support group. So we have those connections and can help people. And finally, raising awareness. This is huge. We're hoping we're going to be back in person for this this May. This is where you can really raise some awareness, raise some money. Everything we do is at no cost to anybody who wants to participate. We charge for nothing. So this is where, it's really important that we bring our community together and have an amazing, fabulous day of raising awareness, raising money, building community, and really making sure that we can sustain the increase in services that we've experienced these past couple of years. And it could be really fun. You could be, everybody on here, you're from, different organizations. You could put teams together, compete against each other, and we have prizes for people, whatever team raises the most. And we have prizes for that. And last year, our prize for the person who raised the most money individually got two Dallas Cowboys tickets to the very first game this year, which just happened to be Monday Night Football, and blue parking passes. So, and then you could have competition amongst yourselves too, to see who can raise the most money. So it can be really fun, even if we have to do a virtual again this year. It could be really fun. But we want to make sure that that this is a big piece, and volunteering for it. You can be part of the community, especially if we're in person. We're going to need plenty of people to help us with registration, setting up, taking down, be part of that, meet people, find other people going through the same, experience as you are. And the last thing I want to mention is that NAMI National, if you look at NAMI.org, they have launched a frontline workers initiative where they have a ton of online resources that you all would qualify to access. So if you go to just Google frontline worker NAMI, you will get that page, and you can look and see if there's anything on there for you for your own self-care. And so I'm going to stop there. I know I see a few things in the chat. So I'm going to leave this up on the screen for a little bit so that you can get my contact information. I invite you to, actually, that's our NAMI information. I believe I have my contact information on the next slide. There you go. So I invite you to reach out to me. And if you're not comfortable putting something in the chat, but you do, have something you want to discuss and you want to figure out what to do, where to go, how to find resources, get some NAMI brochures, put them in your lobby, have them to hand out when you see clients, just contact me. We will make sure you get whatever you need. So in the chat, let's see, I'm seeing things about paperwork. I don't.
Yeah, I'll give them just probably a couple of minutes.
Yeah.
I did resend out the eval and everything to those that were asking for it while you were speaking. So,
okay. I'm going to stop sharing as long as, and I'll put my contact information in the chat for you.
okay.
That way I can stop sharing, see you all, see the chat at the same time, and see if I made my 45 minutes or so. So I am in time. I wasn't able to see the clock while I was talking. So you might have heard me speeding up a little bit just to make sure that I don't take too much of all of your time. But I really appreciate everybody being here today and just listening and making mental health a priority for yourself, for everybody, for your family. And the big thing is let's get this conversation going. We've got an opportunity, especially in the areas that you work in. I know that this is something that a lot of you are probably passionate about and know that this is our opportunity. People are struggling. People are having a hard time accessing services. Texas is one of the most difficult places to find mental health services. So anything we can do to help you get the conversation going and get information out there, just, we can access the NAMI website and download different pamphlets. We have some of our own that we've created to get you what you need in your facilities, in your offices.
I'd also like to mention that we are scheduled for another presentation, looks like on October 19th is the actual date. And so Dr. Trentin and I were also speaking too, on potential topics, or if there's something, specific that you guys are of interest, so that we could definitely tailor that presentation. So please, write that in your chat as well if you have specific topics or certain interests.
Yeah, if it wasn't, maybe I missed something today that you were hoping to hear about, or maybe there's something that I, glossed over or talked about that you'd really like a deeper dive in. I think that, just relay that to Beth and we'll talk about that. And if I'm not the right speaker, we will find the right speaker on that topic.
Mm-hmm. I see the one from Cheryl.
Let's see, can you give any additional information on the source of the data showing 3 in 5 people are dealing with mental illness? I cannot give that source. It's been in conversations with clinicians and people at NAMI national level. It's just something we've been saying, talking as we're seeing data come in. So there's nothing official about that statistic yet. I want to make that clear, but that is what the chatter is right now and how the pandemic has influenced that original 1 in 5. We've got, it would be good to address the interactions of dementia and mental health. That's a great overlap. I have personal experience with that one myself, with my grandmother, my grandfather, and my grandmother's 2 sisters all have Alzheimer's. So we've seen that overlap and the deterioration just because of the frustration and the isolation and not remembering things. That's a great one. We could probably find a speaker on that. I can speak from experience, but not professionally. How about,
I've made note of that one too. So
yeah. So we can look into our community and resources and see if we have somebody who talks about that overlap. We've got another comment. I found the images of the brain scans fascinating. If you can tell us more about the different conditions. Also, do brains progress to these states as the conditions worsen? Again, I'm going to disclaimer, I am not a medical doctor. I can only give you, just anecdotal and what I've learned through the years. So, but the brain scans are fascinating and just being able to see those different colors. So yes, from what I understand, if you were looking at a brain scan, it's that the activity in your brain that is influencing your behavior. So as the behavior gets worse, like look at the OCD brain. If you're taking medication and it's balancing that brain chemistry, just like with diabetes, you take your insulin and it balances the sugar in your blood, you have less symptoms. And your body, if you were to take a blood test, you're going to show less sugar in your blood, right? Same thing with the brain. If you're taking your medicine, your brain is going to show less activity in any one of those areas because it's balancing those chemicals. So I would say, yes, you would see that progression in the brain scans. Again, I've not been through that myself. I've not looked at brain scans myself, but it feels like, that would make sense. Telling you about the different conditions. So the ones that we see most are anxiety and depression, and that can be anywhere from, what I described in myself and still being able to, hold a full-time job, have a husband, be with family, and, be a fully functioning adult, but have my down days, have my anxiety, find my coping mechanisms, to where your anxiety is so bad you actually, I know a few people, especially this pandemic, they are too afraid to go outside of their house, and they've not been outside of their house in 2 years now. So that in and of itself has a whole spectrum. And then it affects you physically, the stomach aches, the, anxiety attacks. You hear all the time, people go in thinking they're having a heart attack and it was just a panic attack. Well, I shouldn't say just, there's, it was a panic attack. And it feels just as scary. People are hearing voices, very scary, especially when you don't recognize those voices aren't real. Some information about other conditions, bipolar disorder. You have really low lows and you'll isolate yourself. And that's one of the very worst things you can do. And that's where the pandemic really influenced the increase in mental health issues, is we were forced into isolation. And so what about those people who, especially like those, recently graduated, first job, moved away from their college and their family, and now they're living here by themselves and working from home and can't go outside, and now they're stuck there. And that isolation is very, very triggering. I mean, I'm an extrovert, and it was just driving me, completely, not being able to have those interactions because the computer's not enough for me. So if I were in that situation and I was just by myself, I'm sure I would have had a lot more problems. Luckily, I had my husband and we live in a nice area. We could go outside and not worry when we didn't know whether or not we could pass it along outside. It's not populated to the point where that would worry us. So in bipolar, there's manic episodes where it can be very risky behavior. It can be spending a lot of money, gambling your money away. We have one family member who calls us every year during our walk and tells us to put a limit on her son's donations, because he will just sit there and keep donating $200 over and over and over again until there's no money left in the bank account. So she calls us every year, reminds us he's allowed to donate once, and that's it. And that's part of his mania. She'll call us when he's in a manic episode to let us know to refund the money. It can be sexual risky behavior. It can be bungee jumping. It can be just, I'm up and I'm going to stay up all night because I'm going to do this. I'm going to clean the house. I'm going to do that. I'm going to do that. And then you crash, and then you're in a deep, deep depression. Schizophrenia has a lot of different levels as well. Schizophrenia can be combined with bipolar disorder. A lot of people think it's just hearing voices and being paranoid. There's a lot more to schizophrenia. There are people who don't hear voices at all, but they get this paranoia that something bad is really going to happen, and that can overwhelm their entire world and their entire outlook on life. So that's just a quick introduction of what I know. I can't give you clinical definitions of it all. But NAMI.org can really, if you go onto NAMI.org, they're a great resource because they have pages on each of those disorders, and you can go in and look and get a much better idea if you're looking for one specific area of it. And then also the role of family history in predicting mental health conditions. There is a role in that. There is a genetic component. You could be predisposed if, let's say, your mother is bipolar. You could be predisposed to bipolar disorder, or at least anxiety and depression issues. So it's definitely, as far as I know, there's no like blood test like you could see if you have the genetic components for breast cancer. There's nothing like that. But having that awareness, knowing mom has bipolar disorder, having that self-awareness in yourself, or you're the mom with bipolar, knowing the early warning signs, because symptoms will start showing up in the teens. But catching those symptoms is the hard part. Because like I said, with my own experience, luckily I didn't end up with bipolar or schizophrenia, but I showed symptoms. I can look back and I showed symptoms as early as 8, 10 years old, but I was just a kid. And then I was going through puberty. So definitely if there is a family history, that has been seen to be passed down through generations. So that early awareness, that early intervention or prevention, making sure that your kid at an early age has the tools to be self-aware, to express emotions, to come to you and say when something doesn't seem right. And having that open communication is really, really important. And thank you. I'm seeing a few great presentations, so I'm glad this has been really helpful today. And I think we have a few more minutes. If there's any other questions, you can put them in the chat, but I'm going to hand it back to Beth. I'm assuming you have a few announcements or closing if there are no other questions.
Actually, it's just thanking you, Dr. Trentin, for your time, your expertise, sharing your stories. What a great wealth of information that all of us can utilize in our day-to-day activities and just be more aware, of mental illness around us. So appreciate all the resources and information that you provided us today, and look forward to coming up with our next topic. Like I said, that should be scheduled for, let's see, in front of me now again. We're looking at October 19th. So it'll be another Zoom presentation from 12 to 1. So I'll be working with Jennifer and Dr. Trentin on coming up with a topic. If there are additional questions that you have, feel free to email me or directly to Dr. Trentin. And
yeah, I just saw one that I can answer quickly with a yes. Does
Sure.
NAMI have an accessible brochure that I can provide to my clients and family? Yes. Send me an email. I can send you an electronic version of our service menu. It's in English on one side, Spanish on the other. And you can hand that one pager out to anyone. We're working on an updated, just trifold brochure, and then I can get that out to anyone as well. But yes, we can provide you with, even we have little business cards. If that's, much easier for you to hand out, it gives just a quick, we're the place to go for mental illness resources, but it doesn't list everything that we offer. So I can give you all of that. You can print it on your own. I can send you some already printed. Just let me know what you need.
yes, Dr. Trentin, if you go ahead and send me your brochure, because I will be sending out the recording as well as your brochure too, then that way I'll be able to send it out to everybody that attended and those that weren't even able to attend today.
Okay, perfect. And that will outline all of the programs that I discussed today in both English and Spanish. So you can print it off as much as you want, because that's not going to change anytime soon.
Mary had just a comment. This is awesome.
Oh, I missed that one. I'll read it for everyone. This is awesome. Thank you, Mary. In the 80s, hearing about mental illness was very scary, but now there are a lot of resources to share. Thank you so much. So that I appreciate that so much. And it's so good to hear that, people are becoming more and more comfortable, having this conversation and making it a priority, because I'm of the American Indian background. And if there's any other Indigenous people out there, we have, and it doesn't matter what tribe you're from, it's called a medicine wheel, maybe called something different in different tribes, but it's divided into 4 equal parts, and it represents a whole bunch of things within that culture. But what holds true to me the most is that whole holistic wellness aspect of it, and it's divided into, mental health, spiritual health, physical health, and emotional health, and making sure they're equal and balanced. If they're not equal and balanced, then we're off, and it's going to affect all of the others. So, we need to get that mental health piece stronger, because I know there's very, very few of us in the world right now who has a strong mental health piece in that medicine wheel.
Well, it looks like we don't have any more questions, but feel free to reach out to myself or Dr. Trentin if you do, and we'll get those addressed. But thank you again, Dr. Trentin. Everybody have a wonderful day, and thank you again for all your support. I truly appreciate it. So we will see you next time. Thank you, guys.
Thank you all for listening, putting up with me. Have a great day and take care of yourself.
Thanks, Dr. Trentin. Take care.